in acute otitis media. Symptoms such as you'll have high-grade fever because of the infection, pain, severe pain, throbbing pain. In babies or children who haven't acquired verbal skills yet, they might be constantly crying and tugging their ears. And then with that, there'll be irritability, fretful, they can't sleep, they can't eat because it's so painful, right? Because it's an acute stage whereby the pressure is all being built up here. So it leads to tremendous amount of pain. Unresolved fever is another common symptom. Parents typically give paracetamol and you see that child is not improving. That means it's progressing. The disease is progressing. So then you need to bring your baby or your child or you yourself as an adult to see your ENT. On the other hand, you have another entity called otitis media effusion. There's no acute symptoms with it, right? So there is already fluid there, but because the fluid is being built up there, the eustachian tube gets blocked. So it cannot drain back into your nose. So it just sits there. With time, it causes negative pressure. So then the child only presents with hearing loss. Nothing else. Doesn't have any acute symptoms. So the child also cannot complain to the parents because the child listens, can hear, but it's just that it's all distorted. So the parent or teacher might say something, but it's picked up something else by the child. So then there'll be some perception that the child is behaving naughty or showing tantrum, but no, it's basically just a hearing loss in a child. Then comes the third entity, chronic otitis media. So how does the symptoms in chronic otitis media differs from acute otitis media? So in chronic, you don't have fever, you don't have all those pain. It's just discharging because there's a perforation in the drum. So there's a leakage, thick discharge and it's smelly. Because of this discharge, it leads to hearing loss because it erodes into your drum and also erodes into your small bones, which are ossicles. So the sound cannot propagate into the inner ear, right? So if it's treated earlier, there's high chances of the drum being repaired. So the leak closes, the perforation closes. But if you do not come and see the ENT, and then the perforation remains more than 4 to 6 weeks, that's it. It becomes a permanent perforation with a permanent hearing loss.